Thank you. So our discussion was around how we can use faculty development for assessment, which is something that all of us do in any case, to embed IPE into the faculty and not regard it as another silo. And there was quite interesting discussion and broad discussion, but basically three areas. The first one was around the fact that it must start from the top. So management and top management needs to be involved. We need to consider rewards and recognition, and we must measure what we value and value what we measure in terms of assessment and also in terms of what the faculty do. And so that links to the tenure criteria. And also that we need to reinforce the behavior that you want and shine a spotlight on it. So in terms of assessment, if the assessment practices focus on IPE in the correct way, that shine a light on that. And faculty development is important, as we know, and we need to use the faculty in the assessment workshops and identify the champions so that we can promote the IPE agenda. Very importantly, in the faculty development workshops itself, in assessment, to emphasize IPE, so make IPE explicit. And to do that by you having interprofessional attendees and interprofessional facilitators. And not only have that, but make it explicit throughout the workshops so that there is a clear understanding of the role that IPE is playing in the workshops. And then the idea is that mutual excitement will carry the momentum, but also not to have once-off workshops and then hope that the excitement will carry the momentum, but to be deliberate in building a spiral curriculum almost around assessment and IPE and build it that way and facilitate the momentum. And then interesting suggestion was also to use students from various professions and also patients in the workshops for assessment, so that that adds a component of reality that will add value. And interesting suggestion also was to look at assessment examples and assessment of the individual and the assessment of the team, and identifying when each is relevant and how to work around that, so that we can start working around the problems that we highlighted yesterday about assessment of teams, and get the faculty in the workshops to start thinking about that. But then also to use existing tools that we heard of, that there are quite a few, and use that as pilot studies in our context to establish the validity of the tools, but also as an instrument of change management to demonstrate how we can use existing tools of assessment to make it easier for everybody, and link to that the shared work, so that now in assessment, it's not I have to assess and you have to assess and you have to assess each a group of students, but we all share the work so that the assessment is shared between us and the workload therefore is easier. And lastly, scholarship. To promote research around IPE-based assessment with IPE with interprofessional teams performing the research, so that the scholarly output of the IPE assessment adds to that in terms of the knowledge created, but also, of course, the visibility and the acknowledgement.
Thank you, Juanita. That's very well put. Again, another complex set of ideas that our facilitators are putting into some meaningful descriptions. We will be taking these notes and, in fact, transcribing them, so they will be in the proceedings in the future deliberations. I didn't realize, unintendedly again, that we were actually moving around the world in some kind of sequence, from British Columbia to Toronto to India, to Delhi, I guess, to Cape Town, South Africa, and now to Uganda. So over to Nelson Sawakambo, who is going to speak to also another question that arose with regards to faculty.